welcome everyone. We're on Planetary Health First Mars next, and we're going to be unpacking longevity, unleashing it, trying to understand it. We have some amazing guests here. So first, I'm going to start with Aubrey. If you can introduce yourself real quick.
Yeah, sure. I'm Dr. Aubrey de Grey. I'm the President and Chief Science Officer of a California nonprofit named LEV Foundation. That stands for Longevity Escape Velocity Foundation. We do early stage research geared towards developing ways to make people live healthier for longer. We are not in favor of aging. We would like to do something about it. And we believe that we are now within striking distance of being able to get the proof of concept in the laboratory that will allow medicines to make people live a lot longer in a healthy, youthful state over the next, for as long as they like.
Excellent. Next, Payal, would you introduce yourself, please?
Yes, I'm Dr. Payal Bhandari. I'm an integrative functional medicine physician. I've been practicing for over 20 years and an expert in solving medical mysteries. I'm also the Chief Medical Officer of Advanced Health Academy. We are the world's most precise lab interpretation solution that looks at the global scientific research and can differentiate between sex, ethnicity, and race to go upstream to understand the root cause. And I am the CEO and founder of Thymus Health. It's an AI-enabled virtual care service that can drive to immediate diagnosis, treatment, and reversal of all 150 plus autoimmune disorders.
Awesome. And next we have, is that Paul? We got Paul. Please introduce yourself, Paul.
Hi, Paul Graywall, general partner at Sick Venture Studio. We build early stage pre-seed biotech drug companies, largely spinning them out of Stanford Medicine. And the drugs and associated diagnostics, precision medicine, and AI. And glad to be here.
Well, it's awesome to have you here, and this is going to be a great time. And moving on to our next guest, Lee.
Great to see you all. Thank you so much for having me today. I'm Lee Shapiro, co-founder and managing partner of Seven Wire Ventures. We invest in companies that are helping to make all of us better informed and connected health consumers. The way we do that is meet people where they are, allow them to have the access to the services, guidance that they need in order to better manage their health on their own, and do that in a way that supports those who are at risk for the cost of care by improving outcomes at a return on investment that makes sense to them. Currently, we have 25 companies in the portfolio. We have been involved in healthcare information technology and the tech-enabled services space for the better part of the last 30 years. Nice to be here.
It's great to have you. And next, Sergio.
Yes, Sergey Polavikov. Hi, everybody. Good to be here. I am statistician and data scientist by training. I founded a startup called Well AI, where we provide AI-based platforms for diagnosis, treatment, telehealth, among other things. And Michael, I also have my own podcast, Digital Health Inside Out. And guess what? The next episode is going to be on longevity. So a very important and timely topic.
Awesome. Awesome. That's glad to hear. And Tom, please introduce yourself.
Hey, great to see everyone. Great to meet everyone. My name is Thomas Clues. I am the managing partner for a corporate venture capital fund called Natera Ventures. We are the corporate venture arm of a large conglomerate called Natera Global. We've got about $1 billion AUM through 2031, and our goal is to deliver both strategic and financial value for the mothership across 3 different areas. One is mobility, the other is sustainability or climate tech, and then the third and one of the more exciting ones that I'm personally excited about is healthcare. So we're really bullish on both the digital and the med tech and the life sciences side of the longevity space. We actually, Natera Global, the mothership, owns a respiratory care business that sells oxygen concentrators and oxygen therapy to a lot of 65 and older patients. So I think longevity for us is really, really important in the context of increasing the length and the quality of human life, and sort of expanding the health span of our patient population. So we care a lot about our patients. We follow the patient journey, and have created a customized investment thesis around following the patient journey and making life easier. In addition to my role at Natera Ventures, I'm also the co-founder of a company called Marche Health, which is a one-stop shop digital health marketplace. We build thematic marketplaces across various pain points across the healthcare ecosystem. Longevity marketplace is one of them. And so we're tracking a lot of exciting companies in the longevity space, and excited to talk about that topic today.
Well, this is great. Glad everyone's here today. And let's start it off with, what is longevity and what is it not?
I can answer that question. Longevity technically means expanding our lifespan. And over the last century, we have more than doubled it by over 30 years. But what we've also done in that mission to never die is we've also significantly increased our rate of people getting sick at younger ages and how sick they become. And so we currently have annually a 19% growth in people developing in younger and younger ages more and more complex chronic conditions, which are on the most part preventable. And so if we really think about the true essence of longevity in the conjunction to health span, it has more to do with how do we expand the functionality and of our cells so that they don't mutate so quickly, in conjunction to how the microbiome, which it makes up trillions of microorganisms in our body, how do we keep that thriving so that we feel, move, think, express ourselves in ways that really are in harmony?
Yeah, that's a really good description. I think in order to expand on it, I would just say that the conditions that are indeed affecting younger and younger people are still age-related. In other words, they are more prevalent in people who were born longer ago. And of course, this happens as a result of success that Payam just mentioned about doubling life expectancy as a result of almost eliminating early deaths, really early deaths, like in infancy. The result is more and more people live long enough to suffer from the health conditions of late life, which today's medicine is really not very good at addressing. The word longevity has, of course, the definition that you just heard, but it has also in recent years become used as a bit of a catch-all to cover both the extension of health span and the extension of lifespan. And I personally think that's a good thing, because the fact is longevity is a side effect of health, by and large. Most people these days don't die from being eaten by tigers or indeed from being hit by trucks. They die from being sick. And as I mentioned, most people's reason for being sick is having been born a long time ago. So for me, this is a good thing that the word longevity has come to prominence as a kind of catch-all for all of these things. It does have the downside that it means what people choose it to mean, and so sometimes it results in people talking past each other. But I think on balance, it's a good thing.
Yeah, a lot of great comments. I don't know if I can add a tremendous amount from that perspective, but what I would add is that as far as what longevity is in my mind, and kind of how we define it is a multifaceted, very interdisciplinary field. So it includes biology, medicine, technology, lifestyle, and policy, all designed to extend both lifespan and health span. We see it as a proactive, not a reactive form of operation. So it's about preventing illness and slowing the biological aging, not just treating diseases as they come at you. It in our mind includes peer-reviewed research, evidence-driven work, and it is very human-centered from the patient perspective. What it's not and you hear this a lot in the press. It's not about immortality, right? So it's not about living forever. It's not just about biohacking or sort of fads like supplements that kind of pop up from time to time. And it is not elitist by design, right? The goal of longevity should be democratized access, not just a playground for people with a lot of money. And it's not just about medicine. It's about when you study the blue zones, what actually drives longevity a lot of the time is social connection, purpose, environment, nutrition, and behavioral health and mindset. So those are kind of my thoughts on the space.
Does anyone would like to add to that?
Yeah, sure. This is Paul. I can give you our take on what we're doing to address our portion of the longevity umbrella. So we think we have our approach is a three-point approach. One is cancer and disease, and the way we're addressing that is by using cutting edge science to number one, detect early disease, detect disease instantly, and using multiple tools to do that, both from sequencing early on and building technologies that can be used and adopted by patients. For example, cheap blood tests to detect early detection in cancer, as well as on the other side is the AI platforms to drive these therapeutics and to have even custom therapeutics and precision therapeutics and treatments for people. We think that does inevitably extend lifetime. The other leg to the stool is regenerative medicine and skin. And we think that we will extend lifetimes, but we think we also don't want to look 120 years old and look 150 years old. So one part of our mission is also to drive businesses that can help with regenerative technologies and then the associated AI. The third-legged stool to that is mental health. And Tom, thanks for mentioning that. But yeah, nobody, we don't know what it looks like to have years, decades extra or double the amount of memories you're supposed to have and then act according to that. So we think the AI is the thread. The other part of that is we don't think much of the living forever portion of longevity happens until quantum is here. And so what we think to prepare for that, the only thing we can do and should start doing is preparing our data and our experiments to not just be ones and zero, it's 1, 0, or 1 or 0 to be quantum ready. So those are the things we're doing for longevity.
And Michael, if I could maybe just add a little bit of context for what Dr. Badani and Aubrey had mentioned, as we kind of track what's happening, when you think about in the U.S. today, 1 in 6 people is now 65 or older. In 2030, that will rise to 1 in 5. And globally, the number of older adults is reaching unprecedented levels. We had roughly 1 billion people age 60 plus in 2020. That's expected to be roughly 1.4 billion by 2030, but 21 billion plus by 2050. And so when you think about the healthcare needs associated with populations aging, just as people live longer, there's need for more food, more services, and in particular, more healthcare services as people are living longer. So that is really why this discussion is so important in terms of understanding how it is we maintain the health status for the larger number of people that are just living longer than what we've seen in the past.
Excellent take. Does anyone else would like to add before we get to our next question?
Yeah, let me just dive in and introduce a little bit of drama into the conversation by actually a bit of disagreement, because one thing that Lee has just said, I think it's important to understand the limits of it. It's not entirely wrong, but it's substantially wrong in my view. Namely, that getting people to live longer, having more people living longer is going to increase the burden on the healthcare system. The reason we have to, well, the thing we have to remember is that the whole purpose of this work is to postpone the age at which people get sick in the first place, which will relieve the burden on the healthcare system. If people live longer, then yes, they're living longer, but they're not living longer. Today, they are living longer in a poor state of health. But the whole purpose of the work that people like me do is to turn that around, to get people to live healthy for longer by intervening at an earlier point before people got sick, and thereby to make healthcare a less onerous proportion of the economy.
I agree, Aubrey. It's also, sorry, go ahead.
We're in violent agreement because, again, I think that's why it's so important we're having this conversation about longevity. Left its own devices, there will be a need for those services. But again, the work that you're doing and what we'll be discussing here can hopefully make a difference in terms of how people progress. I'm sorry to whoever I cut off.
Oh, that was just me. I was just going to make a sort of a side comment that it's also has a side effect of helping drive healthcare costs for people and governments.
Would we like to go to the next question? I think this would really, we have some super amazing investors here. What is the investment opportunity? Tom Clues, would you like to start that?
Sorry, yeah. So the investment opportunity in longevity, or maybe I'll address the investment opportunity for some of the topics that were just brought up, because I think it actually it is a byproduct of longevity, I think, and we're seeing a lot of opportunities address this space. So I will speak to a specific vertical that we're focused on. So Paul mentioned regenerative medicine and skin health, and then Lee mentioned some of the byproducts of longevity in the context of people living longer, and the byproduct of that, which I think is kind of interesting, is yes, people are going to be living longer. They're going to be getting sicker later in life, but there will be a volume of people getting sick at the same time, and that will have an impact on labor force dynamics in the healthcare system. So Lee, I think you mentioned 1 in 5 people in the U.S. will be 65 or older. Our single LP, is a Japanese company, and so we've been tracking that market as well. About 31.5% of Japan will be 65 and older in the next 5 years, and so they're starting to see this convergence of fertility rates at their lowest level, and then people living longer. And they are, as many of you may or may not know, but people in Japan live quite a bit longer than they do in the US. And so one of the challenges with that market, and to some extent we'll see this in the US, is when you have a government payer system, and you have people living longer, somebody has to pay for that, right? And so I think we're seeing some investment opportunities in sort of the call it right sizing, or the optimization of providing more value-based care for those patients in maybe more decentralized, democratized way. And when I say that, I mean specifically around virtual care, but also non-virtual care at the point of where the patient lives. And so we are getting really, really excited about mobile wound care services as an area of focus for us. And actually been focusing on that at Marche Health as well, where we've done a lot of work around the wound care marketplace within Marche Health. And so we're looking at companies that sort of address different parts of the value chain. We're looking at workforce optimization for provider shortages, for select services in wound care and other areas of healthcare like respiratory, but also looking at providing services of care into patient aggregation systems like post-acute care. So we're looking at how do you provide care to the patient in the home, but how do you also provide care to patients at skilled nursing facilities, which are kind of woefully underfunded and candidly aren't doing well financially. And so is there a model that could leverage traditional fee-for-service business and call it Medicare Part A, Part B, and some combination of the two to provide profitable services to patients at skilled nursing facilities and memory care and long-term acute. And so that is an area that I'm spending a ton of time in right now, and find it to be, just very exciting, because I think, spent a lot of time in digital health investing and home care in the past. And one of the challenges there has always been the per unit economics of seeing a patient one-to-one in their home versus going to a place where patients aggregate, right? And sort of, bringing a provider there, but also helping build communities within those skilled nursing facilities. So anyway, I'll shut up now, but that's an area that we are spending a lot of time in right now and find very exciting.
Would someone else like to add to that, Lee, Paul, on investment area in the space, longevity?
Yeah, I'll jump in and just provide again some thoughts. We've been tracking the market for some time, and it certainly seems that funding has been growing fairly dramatically in the sector. Looking back to 2020, roughly, broadly speaking, $3 billion invested during the heyday of 2021, where there was a lot of investment coming into the market just based on zero interest dollars being available. That doubled to $6 billion and then kind of fell off into 23 at again just under $4 billion. But last year it rebounded again, close to $5 billion just in the first half of last year. And I think what's driving it are some of, again, the impetus for what was being discussed previously is the emergence of various opportunities that can come from breakthroughs in aging science, as well as some of the opportunities for personalization of care that can come from both digital as well as other tools that are driving investment in this segment. And then lastly, when we talk about the healthcare market, spend, Tom was mentioning through Health and Human Services in the US, Medicare and Medicaid, but there's also the wellness market that is driving this. This is the amount spent on preventative health, wellness tools, nutraceuticals, and the like by consumers. That's almost as large as the trillions that we spend in the healthcare system. We're also spending trillions there also. So it is a massive and growing market opportunity.
Mm-hmm.
Paul, would you like? Sorry, go.
Well, I'll give you a quick rundown of the specific types of companies that we're seeing, both a lot of co-investing happening as well as excitement around. So off the top of the list, so for cancer, most of the drug companies that we're seeing are going to be more intracellular drug companies. So folks doing RNAi, mRNA types of technologies and delivery technologies and cancer technologies that have minimal toxicity. So the lower the toxicity, the higher the hype for the company, for both cancer and disease, infectious disease companies. And then on the diagnostic side, and like I mentioned before, early detection cancer is the biggest hype. We want to be able to detect it earlier, cheaper, faster. So the companies that are innovating in that area are hot topics and hot targets right now, especially including in proteomics diagnostics, spatial transcriptomics, and anything that tells you that you have a disease. And largely because the sales of that is not just to pharma anymore, it's also directly through wellness centers, through online, through concierge medicine products. So those are also now the other hot topics. So workflow, any company that improves now. Clinical practitioners don't like when I say this, and largely most of my team is MDs, so just so you know, but anything that takes a patient, the clinical care into the home. So, and safely, right? So unfortunately, these are the biggest demanded companies right now. And largely, healthcare is becoming a little bit more democratized than the clinicians want it to be, but those businesses are hot opportunities. And then on the regenerative skin side, if you're on anything to do with exosomes or the healing and anything you sell into a med spa and has high sales growth opportunity. Any of those companies are hot topics or hot companies in the space, as well as platforms for new longevity innovations and technologies. So that's where the new innovation. So largely also remember that academia is being dimmed tremendously. So we also have to think about where the new innovation is going to come from. We think now that this is going to come, traditionally all of that came from academia. Now a lot of that is now going to come from industries and also from the frontline patient facing companies.
Excellent. Does anyone want to reply?
Yeah, I want to reply.
Excellent. Please, Sergey.
I think I agree with the venture capital people here, but from what I'm observing, a lot of the investment into longevity, startup world, for example, it's in the area of reverse aging. I realistically don't see much going on in prevention. I think a lot of VCs, they're looking at payers, they're looking how they're going to monetize this, and a lot of them talk the talk, but in terms of numbers and ROI, I don't see much there. I do agree with people like Eric Topol, who is saying that we need to spend resources on prevention and screening, and as opposed to spending time on all this magic potion and GLP-1. And I actually wish that most investors would actually do that. But right now, I'm just saying I'm not seeing that. I'm actually was looking for like unicorns in prevention area, and I couldn't find any. So until that happens, I think it's a lot of talk. A lot of people kind of agreeing that, hey, we need to do it. We need to have all this screening tools and super diagnostic tools. But when it comes to actual money and investing and support, I personally don't see much.
Yeah, can I dive in on that, actually? Because I think this is a very important point to understand. We talk about prevention and treatment as, two alternatives, but really there's kind of a spectrum between the two. The work that I do especially is perhaps best characterized as sitting in the sweet spot between prevention and treatment, because what I'm focused on and what I believe is the future of longevity medicine is treatments that are applied to people when they're not yet sick, which means they are preventative, but that actually do turn the aging clock back, make people biologically younger again. So in that sense, they are also treatments. And I think you're quite right, Sergey, that the current market does not have a significant exposure to that. There's not much around yet, but it's definitely coming.
No, that's true. There is no preventative market, really. There's early detection, but the preventative is a difficult market to monetize for investors right now.
So far, that's right. Things are going to come along soon, I believe, within the next decade at the most, that are very easy indeed to monetize because they very substantially intervene and postpone the onset of health problems of age.
I feel like this is a Bernie question. Bernie, you're very involved with longevity in the policy space and the government. Would you like to just come in? I know you're having some thunder issues, but are you able to comment a little bit on the policy that we could help, kind of encourage this?
Yeah, can you hear me okay?
Yes.
Sorry for this Palm Beach thunderstorm that I'm enduring. I'm listening to this conversation, and I was inspired to get into this field by Aubrey and a conversation we had. I'm a background as law, policy, and as patient advocate, and I gave up a law practice to work with stem cell scientists for a course of over 2 decades to bring public support to stem cell research and regenerative medicine. Aubrey was on every World Stem Cell Summit that was conceptualized and produced by my nonprofit organizations, World Stem Cell Summits that always had a component of patient advocacy. But Aubrey brought in the longevity aspect, the aging, and the root cause of chronic disease is aging. And it was very relevant. So a conversation a couple of years ago was that how does the field of longevity promote itself? How does it have the investment, the spending from governments? How is it delivered all over the world? That's through policy. And how do we gain policy that provides the funding, the streamlined regulatory system to keep up with innovation, the workforce that's needed to perform all that is required, and most importantly, deliver this to all populations, not just our favorite tech bros. So you have to communicate it, and it isn't just for people who are part of the longevist or vitalism community or people that want to live forever. It is meeting people where they are. And where they are, I have found, is in the patient advocacy community as its core. And with Aubrey's help and encouragement, I worked with Melissa King, who was the first executive director of the California Institute for Regenerative Medicine and led the field operations of the ballot measures. I was involved on the board of that, and we raised $15 billion of taxpayer money by ballot measure, advocacy driven, for the California Institute for Regenerative Medicine, which spawned huge investment in biotechnology and workforce and breakthroughs related to that field. So using that model, we built the HealthSpan Action Coalition to promote policy to actually accomplish these things. And we've built over 2 years, 250 organizations cross-sector. It actually serves the longevity community, not that, and part of the longevity community, of course, is part and parcel in leading this with the policy experts that we have, working on things like the Thrive Act, so that if Mars Candy wants to be able to get their flavonoids in to the FDA and prove they're effective, that they have incentive to do that, to be able to deliver their data, not to impose more regulation, but to provide incentives to get this scientifically based research to the broadest population. The bottom line is we want to capture the public's imagination. HealthSpan should be a basic, fundamental human right. And how do we do that? It's by building networks and cross-sector networks. So policy is going to have a big part of it. And how do we get the federal government engaged in this time of chaos? That's what the work that the HealthSpan Action Coalition does.
I could give you some idea. We're deep in policy here with investments. I could give you some notes on that. Number one, drugs are now way cheaper and faster to deliver to market. They've eliminated this big thing, the requirement of having mouse model data. So now you could go straight to a tumor organoid on a chip. One quote, one of our portfolio companies got a re-quote based on this new policy. It's not approved yet, but it's hopefully about to be. They got a quote that was like, for one drug to go to the clinic, 7.2 million went down to 2.6 million in half the time. So, and then that's for drugs. On diagnostics, they've eliminated somehow the administration and government has eliminated the need for FDA approval at all for diagnostics that have a peer-reviewed journal and a proper, what's called an LDT. I think it's a very safe way to do it, where in a CLIA lab monitored by physicians and clinicians, right? So, so this also has reduced a massive timeline and increased investor returns, or bringing them closer to investor return. So we are seeing a lot of significant interest in the market for both drugs and diagnostics for this reason. And the other side, what RFK is talking about is he's a big longevity guy. He must be. I mean, not saying it, but he must be. But he's making access to nutraceuticals available. The policy around that's what's coming from his office. So nutraceuticals and things like, one of our friends just billed insurance for food for the first time. So this came with our, it might have been your healthcare coalition. I don't know, somebody like you helped drive this. So now insurance can prescribe, insurance will pay for food as a medicine. And so policy is on our side if you're on longevity, 100% right now.
The only response that's excellent. The only problem is when things like NIH or FDA or the NSF, or if you cut the roots of those institutions that are absolutely empowering and great engines for humanity and scientific research, that's the other side of the coin. So how do you work with the policy to make sure that we can keep our enterprise and lift all science? It's not just longevity medicine, but the entire scientific enterprise is the thing that floats the economy in the future.
Well, you want to pick a bone here, and Aubrey's ready to go, and also my partner in our fund is a professor at Stanford, right? So we've been severely impacted by just the NIH and what there's done, and across the country, almost every PI in science has either let people go, shrunk programs, give letters to others. And almost every grad student has been notified you're going to have to pay yourself on year 3, 4, 5 across all science programs. And in 2 years, it looks like most science buildings on university campuses are going to be empty. But at the same time, there was also a lot of redundancy in a lot of research happening. And at the same time, it looks like this is a train that we can't turn around anytime soon. And it also looks like this is the privatization of academia, and it's happening. And early stage translational funds like ours are seeing a lot of opportunity to bring in big dollars and connect CVCs from pharma, help translate some of these ton of science sitting in academic labs, and getting that out to therapeutics. So we think it's a big boon for academia and academic departments. In fact, in our model, we become a massive, because we're translational, so we're working with labs, we become a funding source by default, and probably one of the largest if we do well.
That's very heartening.
I'm just going to add here, because I'm probably one of the only people in the room here that's actually a clinician and practices both management of chronic disease and how do you shift patients to longevity. And one thing we want to think about is we have invested since the 1950s heavily on the research side, but research and clinical medicine don't really have an amazing marriage together. And so by the time it gets into clinical medicine, it takes decades. The other thing is that we need to recognize that in healthcare, we have a model which we have this false perception that we're going to drive to the diagnoses and then we're going to drive to a one-size-fits-all solution for individuals, but it doesn't work. And what we're recognizing is that we do need the precision in how do we look at the data. But one of the challenges we have is that our clinicians are cognitively overloaded and they're burning out, and that more than 70% of our clinicians are specialists that are not really experts on how do you look at an integrative whole person approach. So one of the things that I've done is with the companies that we've started, we've actually looked at the fact that we have data now looking from a science perspective. We can actually understand how do you harness the data in the labs. People are getting labs done there's thousands and thousands of labs, but that 90% of the insights from those labs are ignored. And so we spend so much energy on over testing till we drive to a definitive diagnosis. But the challenge there is that health is not just like a one size fits all. It's not just here's your diagnosis, and for the rest of your time, you're going to fit into this treatment protocol. Instead, when you take a scientific view as an experiment, where when you meet people where they are, and one of the companies that I founded, Advanced Health Academy, we've looked at the global scientific research and we differentiate between ethnicity, sex, and rest, which currently doesn't exist in our how clinicians differentiate labs. But then we harness a lot of insights on here's how your organs are functioning. Here's how every data point is connected together. And here's the lifestyle things that are customized to your labs. What it does is it decreases over testing, which there is a lot that's done in the US because it's all about drive to the definitive diagnoses. But the challenge is that the testings are not benign. They do have risk. And when we don't understand what that risk is for the individual, we can cause harm without knowing it. Number two, when you can detect disease early by laboratory analyses, then you can get people into wellness programs or where they need care. And you can do most of that virtually. You don't need to have them going into hospital systems where they're getting more testing done, but they're not aware of what they can do to fundamentally change their health. And majority of health issues are lifestyle related. So that's the thing. Another thing is that the company that I'm launching, Thymos Health, the whole essence is that how do we drive to precision in the diagnoses and then give people solutions that they understand what does their data actually mean? Because currently patients don't really know what their data means and they don't know what to do with the data. So when you harness the education around the data, how do you do behavioral changing to actually
Pio, isn't that an EMR problem? Isn't that just
no,
like
it's not. It's not an
it's
EMR.
not, isn't that where the data is? Isn't that where it
No,
should
it's
be?
all about, but the EMR is a medical record system.
But that's where the data is. Isn't that where you should solve it?
Yes, but if you look at, not really, because we still have a model where the clinicians are making the interpretations of the data. And they are more likely than not, there's a probability they're going to make a mistake. So the EMR is a great holder of the data. But when you look at the results of the data is often biased by somebody's interpretation. And we know that when you use AI to harness a better understanding of it, you, in conjunction to the analysis that they're providing you, if they're done with heuristics-based algorithms and AI, you can actually drive to more precision on what that data means on the diagnoses. But then when you bring in precision from a science perspective on how do you then use lifestyle measures like nutrition.
When Epic launches their next AI-driven algorithm license model, because they're licensing up all this IP from everywhere, they're going to exactly do this, right? So
Yeah, but
eliminate.
healthcare,
No, they're not going to have it.
clinicians are not
No.
training. They don't do this. They don't
They don't
actually.
do
No.
it.
They don't do all of that. They're
I'm just saying, they don't do it now, but when they version, I'm just saying theoretically, like all the EMRs are going this direction. I mean,
they are
Cerner,
going this
Oracle
direction.
Health is
It's gonna
building
take
this,
some time.
and they're rolling up all the AIs. It's eventually going to get to the point where you have a doctor co-pilot with the clinician.
Correct.
in
They are
Epic
going to do
or
that.
in your
I mean,
EMR.
yeah,
right?
I mean, what
All
Thymos
the ambient
does-
technologies, all the Google projects, all the Amazon projects. This is exactly where they're headed.
correct, but there's
right?
still not precision on
Yeah.
the medicines. How does the medicines connect with their labs? Is there going to cause any harm? Is there supplements? Because that is a value added for patients. They are investing trillions of dollars in the supplement industry. And so is there precision around there? Is there precision around exactly what they should eat, how they should eat it, to their sleep? Healthcare does not focus on the lifestyle elements. Medicine does not train physicians on how do you look at environmental factors or their epigenetics or their microbiome, their probability of cancer cells
Wait,
go.
but we'll be there soon. Some people are there now. Well, my
Mhm.
point is like the world is moving this direction.
The world is moving this direction, and
And a lot of people are working on this, like very smart
yes,
people.
no, that's what we're launching. It's
Starting
literally
Yeah.
to show that we
Yeah,
are
but-
moving this direction. So that's good.
So the question
that's
I have is so the world is going in this direction. The data is out there. I think there are solutions or technology capabilities that are able to fathom all of this and execute. But I think the challenge is who sort of pays for it, right? So you're talking about, Epic doing all this consolidation of their data and providing these AI-based solutions, but who's going to pay for it, right?
Yeah.
Is it going to be the government, the employer, the insurer, individuals? I mean, consumer, that's
for
a
what?
very difficult
Pay
market to
for
get
what?
into. So
Pay for what, Tom?
pay for these solutions, right? So these are solutions that presumably would provide value, right, around longevity and around prevention of disease.
I
But
think
in
think
order
largely
the first question that was asked was around, does the venture capital market scale here? And so my question is, you need a business model that represents that is fundable. So that's
the business
that's my point.
yeah, that is two things. The direction is moving there, but does the business model support that? No, I don't think so.
Right.
In fact, it
And that's
should be free. I
Should
mean,
be
you
free.
should ChatGPT 5 should be able to do all this.
So if I could chip in for a moment, as first of all, someone who works in the non-profit sector, and second of all, someone who was brought up in that far-off place called the rest of the world, where we have a sensible healthcare system, I do want to emphasize that the question of who pays for things kind of goes away when the cost savings to the economy overall are as enormous as we're talking about, or what we should be talking about. Because at the end of the day, the the economic incentive structures and tax structures and so on are determined at the national level by the government. And when the rules change in terms of what's possible, the incentive structures will be reconstituted appropriately to fit the new opportunities that are coming along. We're talking about trillions of dollars per year. I mean, tens of trillions of dollars per year that will be saved with the advent of even modestly effective age-postponing medicines. And as those things come along, governments will respond in order to make a business model for all, for people at every point in the industry.
Bernie and Aubrey had touched on this, and I think it's maybe Dr. Bhandari, it's less about the data issue and aligning the data issue. I think moving upstream from that in terms of aligning incentives is really important. You've mentioned, and others have talked in this program about the impact that prevention can have, the impact that a better understanding of nutrition, for example, or use of some of these new tools from a diagnostic standpoint can provide in improving health, and therefore reducing the burden that may come from aging, associated with aging. And I think that if we were able to align incentives so that there's more dollars that are invested earlier in life in terms of driving some of that prevention, we'd see some of those savings that Aubrey is mentioning, as opposed to trying to intervene at end of life in a very costly way. So that's where the work that Bernie's doing and others are focusing on in helping to drive some of the discussion around the way in which we start to bring these new innovations to bear on these types of challenges can allow for the type of impact that these new longevity solutions can provide.
Mm-hmm.
I want to respond to.
Sorry, I was just
Sure.
going to say one of the most effective places, at least in the U.S., is on maternal health. We have one of the highest rates of morbidity and mortality in maternal health, and we haven't really made that much of a shift. We still have every third birth is a C-section baby. A large percentage of people are bottle feeding. Women and their families are not well aware of what's going to help them prevent a lot of the catastrophic issues that are impacting their lives, but it directly impacts the child and the child's health and lifespan. And so if you're thinking from an investment point of view, there are so many simple things. How do we help impact the maternal?
Well, I can tell you, Pio, one of the problems with that is there are only like 3 or 4 femtech funds. There are no femtech funds outside of like Portfolio, Fosbashi, and like just a handful.
No, again, they're really heavily focused on menopause, for example, but in talking about like just women and the fact that a lot of the science that's come out has heavily been much more around Caucasian men, and only since 1993 was it a requirement that women had to be part of the research, but it's not like they're 50% of it. It's not like we look at ethnicity, sex, and race, but just simple in terms of just when a woman gets pregnant, what kind of care is she getting? And when there really isn't enough of an infrastructure to support it, and that's not very expensive. I mean, we have more and more women that are now diagnosed with hypertension, preeclampsia, diabetes. There are many walking in and they're overweight and they're predisposed for major issues. And that sets that person and that child, and they come out in the world for a decrease in their health span. So those are simple tools that it's not a lot of capital. It's about what do you value on your investment? Because if you're thinking about aging population, there are still babies that are being born. How do we harness the value that we can already do by decreasing C-sections? Like they're not necessary. How do we help with getting doulas and midwives and getting?
I'll tell you, Pio, the answer is not that. Investors don't invest into femtech.
So I'll make a shameless plug here. We are not, so to be clear, we're not a femtech fund. We don't focus on femtech, but I do agree with Dr. Bhandari's thesis around, longevity starts at the very beginning, right? And it starts early on in life. And we did our venture studio, which we no longer operate, did create a pregnancy app called Nanelle, which is alive in Germany and the UK. A little bit of a shameless plug on Nanelle, but we're finding the space very interesting and are continuing to invest in the company and watch it grow. And we're currently working on a collaboration. I won't name the name of the country, but we're working on a large public payer system collaboration with one of the countries in the European kind of ish ecosystem, and we are working on how do we detect preeclampsia early on, how do we detect gestational diabetes, how do we predict complication rates of pregnancies early on. And I think it starts with forging the relationship with the newly minted mother, right, at the very beginning, and then building an ecosystem from there. So anyway, I just wanted to throw that out there. Paul, I agree with you. There's not enough femtech funds out there. I think it's a crowded space, but we are out there and we're very open to femtech opportunities.
Can I add something to that for a second? It's where do you promote things? How do you promote things? Part of it is the power of narrative. And in the stem cell world as a model, the power of patient advocacy, the narratives of the patients themselves, people like Christopher Reeve, Brooke Ellison, so many others, brought it home. And if you can empower and give platforms to the communities, such as the femtech community, the women's health community, and provide platforms for them to get that message across,
that's what they need.
Dominoes will start to fall.
Yeah,
that's what they need, Bernie. It's a shame. I helped raise money for a femtech fund. My friend, oh my God, nobody would talk to her, and they would talk to all the other funds.
Yeah,
so
I'm going to say the same. It's very difficult. Even if you're like what I've proven out on our model, we drive 80% reduction in symptoms within less than 90 days and 80% reduction in the total healthcare burden in a year. But getting attention to get the funding is not easy.
It's really difficult. There's another guy.
Very difficult. We talk a lot, but where you put your money is what you value.
Not only this, listen to this. There's a guy who has a femtech. He's the CEO of a femtech company. He has an opposite channel. The femtech companies don't want to talk to him because he's a guy. And also solving like ectopic pregnancies. It's a wonderful company.
Yeah.
And by the way, femtech funds actually have higher IRR according to
the highest,
peer-reviewed research. Small sample
exactly.
obviously, but
that's what I used to say to people.
Realized or unrealized? Do we know?
There are a number of studies. They look at different metrics.
Okay.
And, or as a median, femtech is doing very well.
No, I'm No, it's a very interesting space. The only challenge I have with it, and this is again, we don't have a focused category for this just yet. We have the one company. It is a crowded. Right. So I know there's not many femtech funds, but for whatever reason, there's a lot of pregnancy apps out there, and there's a lot of kind of postmenopausal and menopausal apps. And so it's just hard to kind of figure out, okay, who's doing what and what's the business model difference between these two.
Why don't you go outside of femtech funds directly to femtech founders? There are a lot of them out there.
Yes.
There are a lot of them out there.
There's a lot of them. Exactly.
Well, that's his problem. He's going to all the founders. I would go to the funds. Talk to Jessica, Tom. Because she knows she has a whole DD team, and she'll tell you which ones are the good ones.
Yeah, we are actually.
They get the funds to join the HealthSpan Action Coalition. It doesn't cost anything. All right.
I tell you, come on, Planetary Health first.
Brady, you need to help them
get
raise
all
their
the
money.
answers on this call. This is great.
So I think you never know what you're gonna get when you come on Planetary Health first. You come on longevity, you end up starting a femtech fund. But
now we're raising Jessica's femtech fund. Nobody's even met her.
Yeah. I want to be respectful to everyone and their time. I think we want to probably wrap it up. I would love this as an opportunity for each of you just to have a takeaway, kind of any sort of thing that you think would be a good shout out for our conversation today, for our series 2 for next week, and then our report coming up in June.
I'd like to say that I love how passionate this was. We had a lot of views represented very articulately. And, when I come on panels that are this big, normally that doesn't happen. People are far too respectful to each other. So I really enjoyed this, and I think it's a good advertisement for future episodes.
I got a quick story. This week I was called by a parent who started something called the Coates Plus Syndrome Foundation. It was a lawyer in Palm Beach and Broward County, has 2 children, lost one at age 4 with this rare genetic ailment, and is building a foundation from scratch for gene editing, creating iPSC lines. And it was the most heartrending story because he will lose his other child, his 8-year-old, to this affliction. And listening to that story and understanding that this was a story I have heard many times before, and seen these tiny organizations of gathering rare diseases and realizing that they are part of a network of health span. As someone said on this call, it starts in the womb. You start to age, and realize the power of that narrative. He sent me as a video, a eulogy that he gave for his little boy. And it struck me, and by offering just the generosity of listening and providing connections, that is, our generosity is a miracle to some people. And the intelligence, and I thank you, Michael, for bringing all these people together. You are elites. You understand this. You have so much to offer to the field. And I just want you to know how inspiring all of you can be when you think of this as a big picture and what we're doing for our species and for the world.
Oh, thank you, Bernie. That means we're going to stay with you when we come to West Palm Beach.
Absolutely, in a spare bedroom. Come on.
Oh, excellent.
I want to make a plug for AI in general. I think, people are criticizing AI. Some people are optimistic. We have Dario Amodei, who said that we're going to double life expectancy because of AI and its effect on health prevention. He said 12 years. Now he's doubling down to 5 years. I don't see mathematically how that's going to happen, but I think there's a lot of things about AI people don't understand how powerful it is, and that it can handle things that humans cannot even comprehend. So just shout out for AI in general. And I also want to talk about something we haven't talked here, but when I'm talking AI to medical community, it's kind of funny, but in my world, it's actually a lot of small guys that appreciate the power of AI, the opportunities, as opposed to like larger health organizations. We're working with a lot of sort of small and mid-size and independent organizations, and I think it's important to mention grassroots movements like Health Rosetta, that I think just in general value-based care. I plugged my podcast, Michael, but this is what we talked about on Digital Health Inside Out last time. There's a big connection between longevity prevention and value-based care. Again, seems like in this country, a grassroots movement, but I wish it was bigger. I think the problem is funding, as always, but the fact that we can use technology and we can use ways like direct contracting for employers to communicate and be served directly by physicians, as opposed to all this bureaucratic system that we have. I mean, I kind of like that system, that proposition, but unfortunately, it's still at a grassroots movement stage, and I wish it was larger. So, shout out to small guys, shout out to AI.
Awesome.
Michael, thanks again for hosting us. I hope to see you when we get this panel back together again in 50 years.
Yeah, this was, Michael, thanks for facilitating. This was an awesome one. Very astute panel. Certainly no wallflowers here, so good provocative questioning and challenging each other. I think my biggest takeaway from today is, longevity increasing health span. It's not a scientific problem. It's a business model challenge. That I think if we want to extend the health span at scale, we need to figure out how to fund the future with incentives today between the powers that be. And I think that means we have to rethink who pays, how we measure the value, and what returns really mean in a longer, healthier life.
Yeah, I'm going to agree with you, Tom. It's really where we invest our time, our money. It speaks what we value. And so if we invest as early as we can in both the people who are the game changers and are seeing this from a macro level, I think we can really influence then policy and work together to really drive an impact that both helps both every player, the payers, the investors, the patients, the clinicians, and really recognize we do need each other. We're not really, if we take that shift into, if we can work together and say, I agree, this is not a science issue. This is fundamentally about how do we expand the well-being of us in general as both individuals, our families, our communities, our countries, then we can drive massive change and see that everybody is burning out. So how do we harness what we can do and really make it work for all of us to be winners?
Okay.
All right.
Okay, sorry.
I
Yeah.
was going.
I don't what. Great meeting you guys and great discussion. I think there's a lot of insight here. And see you till the next time. And every 50 years, lead, not in 50 years.
Our people.
All right. Well, until next time, we will take it to planetary innovation today. This was definitely a show, a moonshot for minds redefined in health. Thank you for coming. We had an amazing panel. Until next time, friends.